So in this lesson, we're going to look at specific tissues and how they heal relative to each other and relative to the normal aspects of healing. Now, it's important to realize that although we're going to be talking about time frames because different tissues heal on different timelines based on a variety of different things, primarily the amount of blood flow and the ability of that to repair the tissue. But each condition and each patient is unique. And so there are all sorts of different unique factors that affect the ability of a patient to heal. And so it's important to realize that each patient should be treated uniquely and progression should be made based on what you're seeing clinically, not necessarily based solely on timelines. One of the most annoying things personally is when protocols are too timeline dependent with that. There are minimums amounts of times that you should see, right, that allow for healing to occur. But just because somebody is 6 weeks out doesn't mean they're necessarily at a healing point that they're able to do 6 weeks out exercises in a protocol. So the first one we're going to look at now is ligament healing. And ligaments heal pretty much along a standard approach with that. We have the injury site and the ligament stumps occurring right away. With that, we then see the infiltration of the monocytes and macrophages. With that, fibroblasts start to go through, goes through a normal proliferation phase, starting starting about day 3 all the way up to 21 days in that proliferation phase, and then the remodeling phase occurs after that. Up to about 12 months before we get more ligament normalcy as far as its ability to restore normal tensile strength. For muscles, like we said before, muscles heal a little bit differently because they do have a little bit more of a regenerative capacity, where in that first week, muscle regeneration can occur through satellite cell activation in a minor injury. More major injuries require scar tissue to occur. We can see tensile strength returning relatively quickly, and some of that also occurs because of the ability of the muscle to resist force through its own contractile properties. So it can increase its normal tensile strength a little bit sooner. However, you can see it takes much longer for the contraction component to occur. And so you can see here, even 6 months out after a major knee injury or a major muscle injury, we still might only be seeing 60% of the normal contractile properties. And there's a variety of different reasons for that, and we'll look specifically at muscle function in the injury process later on in this course. Articular cartilage now does not heal particularly well, and it has very little regenerative component, and even then type 2 calcified cartilage is what we're going to see there. But when we get into this, type 1 cartilage is what is going to be replaced with. So we have a type 2 calcified cartilage that gets replaced with type 1 cartilage. So we really don't have anywhere close to the same type of cartilage being produced or collagen being produced. So the healing of articular cartilage is not very good at all. We just try to fill the deficit as much as possible, but we lose a lot of that functioning, which is why knee replacements and joint replacements due to arthritis are so common. Bone healing now, again, is going to heal via osteoclast and osteoblast function. With that, the osteoclasts are now going to serve more of the role of the macrophages in the specific component of the dead bone, whereas macrophages now will remove the debris and the more organic component. That takes, about 3 to 4 weeks for proliferation to occur, where we can get that hard callus that's developed. That's why they're in the cast for that particular amount of time most often with that. And then near normal strength is occurring at 12 weeks, because so much of bone does repair and replace through regenerative fashion opposed to replacement. And so again, that is just a quick overview of the different healing properties of the most common tissues that we will be treating with. Next, we will look at an overview of interventions.